and I was diagnosed with bipolar disorder when I was 19. I have an unusual trajectory for my mental health because I actually was diagnosed when I was studying abroad in England. So poor parents of mine had to receive a lot of their education, and I was in an institution for a month when I was in England. It took a long time to kind of get me down from my mania so I could manage just kind of my day-to-day life. But I came back without medical bills. I had a month worth of medication I didn't have to pay for. So that was not a burden I took back with me, which most people do.
The behavioral health system we have created leads away from innovative programming that meets the needs of the marginalized. Over the past 7 years, we've had to jump through all manner of hoops to keep this program up and running. We've provided unpaid interns with gas cards. We've subsidized the salary of licensed clinicians. We've begged our friends and family members for favors. We provided stipends to clinicians so they can meet with caseworkers. We paid for coffees, for missed appointments, for cell phones, and for program evaluation. All of this has cost us a small fortune. We have spent hundreds of thousands of non-Medicaid dollars from small foundations and donors to keep WIMP afloat. In short, I would simply say to you that the resources for innovative care dedicated for the most vulnerable among us are gathered from the willing, the compassionate, and the sympathetic. And once gathered, these resources are nearly always under threat.
The fact is, and this is really important, there is no care in Colorado anywhere that can take care of David and these other adults like him to keep them safe and healthy and well.
My sister Lois was under constant treatment from age 15 to 69 for schizoaffective disorder. I would hope that we could provide care for them, possibly in nursing homes that house the mentally and the physically disabled. But we have some needed requirements.
Another thing we need is more assertive community treatment. That's wraparound services for people that on the outside need a lot of support.
We had no sign language interpreter, so we had to write back and forth to communicate.
So I have a lot of experience dealing with the system and then falling through the cracks of the system and kind of critiquing the cracks as I fall through them and trying to somehow grasp at things and keep myself together.
One of the things I was extremely frustrated with is that and you're all aware of this at this point, I'm confident, is that the RAE had reduced the rate for the provider network to 20% effective January 1st. You're aware of that.
Deaf people are subjected to a significantly greater number of mental health risks than their hearing counterparts.
Showed that while 28% of the general population of Coloradans in greatest need of receiving behavioral health services receive services in one of Colorado's community mental health clinics, in stark contrast, only 3% of Colorado's deaf and hard of hearing citizens in need of services receive them.
Unlike other illnesses, in Colorado, our medical industry has decided to eliminate mental illness from its list of illnesses they treat and instead to criminalize mental illness. A person with a mental health diagnosis does not receive the equity to reach their full potential that the rest of us do. Drew's first inpatient stay was after his freshman year of college. He had been very anxious after coming home that summer, and one night he was having delusions of grandeur and suicidal thoughts. We took him to the hospital, and in spite of being very calm and being very medicated by the ER, Drew was cuffed and shackled to be transported to Mine Springs and Grand Junction.
I had all these injuries that had this significant impact on my life. I could see where they manifested in my life. I started drinking and drugging when I was 12 years old, full-blown alcoholic by the time I was 13. I talked to one of the professionals and he said, given your history, there's no doubt you have a history of brain injury. So now here I am, 35 years old. It's the first time anybody even said to me they possibly had brain injuries.
On December 1st, 2016, I received a phone call while at work that would change everything about my life for the next 2 years. But my 12-year-old daughter, Kennedy, had attempted suicide while she was at school. And over the next 12 months, Kennedy would attempt suicide 5 more times. And when I thought about what I wanted to talk to you all today, 2 things came to mind. time and lessons learned. The time that Kennedy was given to have her depression and suicide ideation assessed and understood and treated did not come easily.